Hey team, Dr. Josh Wagner here with Patient Mastery, and I've got 3 key strategies to share with you for hiring associates that are going to be a right fit and help grow your practice, give you more time off, and help more people, rather than what I see too many docs. I'm seeing it in Patient Mastery as docs are getting busier, want more helping hands to be able to help even more people and take time off and not following these steps. And what does it look like? You take on a doc, an associate doc, they sit there waiting to get fed while your practice stays the same or even declines. You're paying a doctor's salary for your profits to go down and you to pull your hair out because you didn't do these 3 steps. And why would an associate join your practice and your practice would stay the same or decline? The basic reason of, if you don't do what I'm about to share with you, what happens? Associate comes in, and let's say you're attracting 25 new patients a month. You take 13, the associate gets 12, and you had a really good conversion and retention rate, but the associate doesn't. And now 80% of the patients who you would have started and retained and been getting paid and getting good results are slipping through the cracks. So literally half your new patients are being lost to someone you're paying to lower your practice. So that's actually what happens too far often. And if you've had associates, you probably know that can happen. And if you haven't, heed the advice. Just because you can hire someone doesn't mean it's going to work out. So the first aspect, and this is for before we even get into the associate being in your practice, is spread the net. So first one, a lot of docs have a hard time finding an associate because all they do is post in their state association and post in the college, the chiropractic college closest to them. And you're touching on maybe 2% of the possibility. You may be in Ohio, Minnesota, and think, why would anyone in Florida ever come here, or Wyoming ever come here, or why would I advertise at Logan in Missouri College? Well, we don't realize that people are willing to travel nowadays more than ever. If you were to sell your practice and you use a broker, that broker would not be advertising your practice just within your state. They would be advertising it countrywide, let alone worldwide. The same thing has to be when you're looking for an associate, because you are severely limiting yourself. So every single college, put the ad in, and as many state associations as possible, and I promise you, you will have many, many more applicants. There are also the associate matchmaking services and headhunters and all of that. I don't have a preference or recommendation. I hear good and bad from all of them, just like any business is gonna have. The one thing you have to go into those relationships knowing is based on the business model, and I'm not saying it's wrong, their goal is to get you someone as quickly as possible. So they're more likely going to give you the first and the next rather than the best, because as soon as they place the associate with you, they can then go on for their next client. And the longer they're spending time looking for you, the less time they're helping other people. So you just got to take that into account, realizing, hey, is this associate they're giving me jumping through all the hoops, which I'm going to get to next, or is it just, hey, the first set of hands that's willing to move to my area? Next, when you get that match, whether it's through a service or people are applying directly to your post, the second is right here. Manage expectations to win. If you're hiring an associate, a lot of docs, you do the personality tests, you make sure they adjust, you make sure they have a good attitude, they're willing to accept the terms and all that. That's great. But if you want an associate who's just going to sit there and say, feed me, and I'm waiting, I'm waiting, then don't do anything else. If you want an associate that's going to help build your practice, even though they don't want to have their own practice, just ask them for one thing. Give me one sheet of paper of a business plan, and business plan is too fancy of a word. Just give me one sheet of paper of what you're going to do when you come here to help grow the practice. And you will see by the people who respond, and many of them probably won't even, do you get a full list of a dozen or more things that they're going to actively do? That shows they have a head on their shoulders that they're a go-getter. Because if they don't send that, don't count on them doing more than 1 or 2 things to actively help grow your practice. And I don't mean they need to be out in the community marketing and standing on rooftops and kissing babies. It could literally be things they do inside the practice, or their commitment to deliver great table bedside manner and own the consult and the recommendations and re-exams and all of that. You will find that out just from asking, hey, send me back no more than 1 page, everything you're going to do to help grow this practice. And you'll see, do you have a go-getter, or do you have someone who's just going to sit there and say, feed me, pay me to take on to take some of your business away from you. And the third one is timeline for success. That's what I wrote. Timeline for success. So let's say they send you that page and it's like, oh wow, this person put 15 things that they're going to do. I don't expect them to do it all at once, but are there any future forward timelines of, okay, you wrote these 15 things. Well, when are they going to be done? You said you're going to do a talk a month. Well, when's the first one going to be scheduled? Do we have any tracking that you're actually doing a talk a month? Outside of that is, what do you need them being trained on inside your practice? If they're going to be seeing new patients, do they own the consult? Do you even own the consult? Are you winging it? Or patient mastery of a 6-question consult that's going to have people begging you to receive care and pay for it? Do they have to know that at least 80% quality before they even start with you, or before their day 7, and then they present it to you, and then you show them where to make it better, but you're not teaching them from scratch? Are you going to have them give recommendations? Hopefully, if you have an associate, they can take over and handle recommendations for you. Is there, by day 30, you've shown me that you can do a recommendations combo 80% as well as I can, and then you do it, and then we're going to help you get it better. Docs fail to have timelines for success of expectations of this needs to be shown proficiency, and then what happens? Doc is doing everything they're normally doing, associate's sitting there, feed me, getting paid that 5, 6, 7+ thousand a month, and the practice stays the same or goes down because the doc gives the associate new patients who doesn't have the skills and training to start them, retain them, get them paying, get them continuing. And so half your new patients start slipping through the cracks and your practice goes down. As your payroll goes up, you want to pull out your hair and you're like, what did I get myself into? Follow these 3 steps, will solve 80% of those issues. You need any other help? You want the actual 6-question consult, the 5-step recommendations, how to create care plans that people will pay happily and still refer to you? Just send me a message. Help, drop a line under there, go to patientmastery.com. We will show you exactly the proven process. Thanks for all you do. Keep helping tons of people get well.